I'd went for quite a while without enjoying life, simple things or otherwise, the things that we did because of the fact that I wasn't feeling well. Started probably almost 2 years ago. I wasn't feeling right, but my symptoms were at that time, I would have dizziness. As time went on, I was always working out 4, 5, 6 times a week. I got so the treadmill, I was turning the speed down. I was going shorter time length on the machine. And it was just activities like that I noticed a difference, but that was, I think, the hardest part for me was, why am I feeling this way? And it was a very difficult situation because I knew there was something not quite right, but I knew there was something wrong. I could tell my body was fading away. I knew that if I didn't get help, I was going to die. I just felt that inside. I couldn't get out of bed hardly. And during this time period, I went to several doctors, which sent me to specialists. And it always took time to get in to see a new doctor, and then they'd pass me on to somebody else, and I was keep going through the cycle of going to see somebody new and somebody different. So that was really frustrating. Spent a lot of time traveling to different places. I had one of my episodes on a Labor Day weekend on a Monday. I guess I was a walking heart attack looking back at it, because it was about a month later. I had kind of an achiness in this one arm. And I never had, this whole time period, the year and a half, I never had any aches or pains, nothing like that. It was just kind of an ache. I don't know, I just felt that maybe I should get that pain checked. And I went out, nobody was around, only one neighbor, and I hollered at him and he came down and he immediately called 911, so I must not have looked quite right. And they gave me 2 choices. And I said, well, let's go to Allegiance. I've never, been there. And so that's where I ended up going, was to Allegiance. As soon as I got in, I went into this room and they took my vitals, and I was just immediately sent down to the cub unit, which is the heart area. And I was immediately surrounded by people and tests, and it was just amazing, just absolutely amazing. And not too long thereafter, Dr. Maka, the heart surgeon, came in. He sat down with me and said I'd had 2 heart attacks. And I said, Dr. Maka, are you sure? I just could not believe after all this time I would have a heart attack. I was always watched my diet closely and worked out and never smoked, never did any of the usual things they always ask you, did you do, that are coincide with heart disease or heart problems. And it was almost a relief that I had found somebody who listened to me and who tried to find out what was wrong with me and did it. All these other institutions, I just never felt like anybody really looked at me and listened to me. But Dr. Maka was very kind, showed a lot of empathy, very professional, very, very professional, and I was at ease with what he told me right from the get-go. And my experience there in the cub unit the whole time I was there was just phenomenal. It was quiet, it was comforting, it was a very peaceful environment. They made us all very welcome there. And that was, to me, a big relief because I'm uncomfortable with medical issues, and I wasn't there. And I like the fact that you had your own room through the whole process. And that was a nice plus, too. And they brought all the equipment into my room, so I was never shuffled to have tests done. The tests always came to me, and that was nice. But it was, I just can't say enough about the comfort that I had, and it was shown by all the nurses there, and pretty well recuperated now. And I'm back to doing the things I loved and was afraid to do or couldn't do. And I'm enjoying it again. Totally enjoying it. And I think my friends and family are enjoying having me back. Now I'm finding more time to do things I really, really, really enjoy, just myself, and projects, I call them projects, and appreciate just taking time out and watching the sunset at night instead of, oh, I should be doing this or that. No, I don't have to do this or that. I'm going to sit and enjoy the sunset. And that's basically what I've been able to do now, is to, it's taken a little time since I've been healing, but I'm pretty much doing everything now that I've always used to do. And I'm not scared to do it anymore because I'm okay, I'm fixed. They tell me I'm okay, I'm good to go.